Sorry, Krab. I'm Dr. Chuck with CMAC. Today, I'd like to continue with anatomy to the video of the heart. Today, we're going to be looking at the heart valve and its location and most importantly, the function of the heart valves. The previous review video, I talked about the chambers of the heart, and if you're interested in it and have not seen the previous video on the chambers of the heart, you can watch it right here. I'd like to continue this review video in the English language. As I've mentioned in the last video, that English language is a universal language of medical education. So if you're a Thai medical student or a Thai health field student that have been following my review video, this should be a good change of pace for you. And most of the board exams, such as the USMLE, is in English, right? So it's very helpful to go over some concepts in the English language. As I've mentioned, my videos are not lectures, they're reviews. I'm simply going to be going over the important concepts of what they like to ask on the board exams. And most importantly, I like to look at the clinical relevance. So I recommend that you watch this video after you have attended your lectures with your professor at your university, and then you can watch my video. After you have watched my video, don't forget to do your Q banks, your USMLE World or whichever Q bank you choose to do. Medical education is all about repetition, right? It's not about how smart you are. It's not how about clever you are. It's all about discipline in your study and repetition. You're going to sit down and work your concepts. So with your professor's lecture, and then you have my review video, and after that you do your question bank. That's 3 different angles to look at the same concepts, and that's repetition. And repetition will bring in what you learn into your long-term memory. All right, today I want to review about the valves of the heart, its location and its function. But first of all, I'd like to do a very quick recap on how the blood moves through the heart. So the deoxygenated blood, that's blood that have been used up by our organs, right? So our organs have extracted oxygen and have extracted nutrients from that blood, and that blood becomes deoxygenated. So that deoxygenated blood goes into your right atrium of the heart, where two main veins, right? The superior vena cava and the inferior vena cava. So basically the superior vena cava drains the deoxygenated blood from your upper body, from your head and neck and your upper limbs, goes into superior vena cava, and that deoxygenated blood goes into the right atrium, while the inferior vena cava drains the deoxygenated blood from your lower half of the body, your lower limb and lower part of the body. So that deoxygenated blood goes into your inferior vena cava, and the inferior vena cava dumps that deoxygenated blood into your right atrium. So upper body, superior vena cava, lower body, inferior vena cava, takes the blood that have been used up by the organs, the blood with low oxygen supply, and put that blood into your right atrium. So now the deoxygenated blood is in your right atrium. Where does it go next? It goes into your right ventricle, right? So from the deoxygenated blood from your right atrium to go to your right ventricle, it has to go past a valve, and that valve is called the tricuspid valve. Tricuspid valve. So deoxygenated blood from your right atrium goes past the tricuspid valve into your right ventricle. Now the blood is in your right ventricle. Your deoxygenated blood is in your right ventricle. Where does it go next? It goes into your lungs. It has to go into your lungs via your pulmonary artery, right? To your pulmonary artery, into your lungs. There is a valve between your right ventricle and your pulmonary artery, and that valve is called the pulmonary valve, right? So your deoxygenated blood in your right ventricle has to go through your pulmonary valve and then into your pulmonary artery, and then from then the pulmonary artery will take the deoxygenated blood and put it into your lungs, and that blood, when it's into your lungs, it will go into capillaries, little capillaries, little capillaries, right? And capillaries have holes. They're fenestrated capillaries. Why does the capillaries have holes? It's so that the oxygen that we breathe in can diffuse into the blood, right? So when the oxygen that we breathe in diffuse into the blood, now that blood can pick up the oxygen and it becomes oxygenated blood now. So now this oxygenated blood or the blood with high oxygen content will go into your pulmonary vein, and pulmonary vein will put that oxygenated blood back into your heart, to the left side of your heart. It will go into your left atrium first, and from there, where does the oxygenated blood go? Where does the newly oxygenated blood go now? The oxygenated blood now from your left atrium will go to your left ventricle, and it has to go past a valve, and that valve is called the bicuspid valve, or another name of it is the mitral valve. So from left atrium, the oxygenated blood has to go through mitral valve into your left ventricle. And where does that go? The left ventricle will pump that blood, will pump that newly high oxygen content blood to the rest of your body, to your systemic circulation, pass through your aorta, right? So left ventricle pumps that blood through your aorta, and your aorta will put that blood with high oxygen content through the rest of your body, and the rest of your body can use up that oxygen again. But that's a valve, right? Between your left ventricle and your aorta, that's a valve. It's called aortic valve, aortic valve, right? So the blood has to go through your aortic valve, and then it go through the rest of your body. And we can easily see, right, that the right side of your heart carries the blood with low oxygen content, or deoxygenated blood, while the left side of your heart carries blood with high oxygen content, or oxygenated blood. So this is how blood moves through our heart past these four valves. So we have four valves, right? So we have the tricuspid valve, we have the pulmonary valve, and then we have mitral valve, or another name of this valve is called the bicuspid valve. And finally, we have the aortic valve. So the blood have to move through the heart, pass all these four valves, and then back into systemic circulation. And can you guess the function of these valves? You can probably guess by now. So these valves are one-way valve, right? And the main purpose is to make sure that when the blood moves through the heart, it goes in one direction. There's no regurgitation, or there's no blood backing up, right? So the valve have to open and close in a timely manner, so that the blood can move in one direction, in a forward direction, right? So if there's something wrong with the valve, and there's a regurgitation, or the blood kind of moves backward, there could be some consequences, right? Patient can have some symptoms, and some symptoms could be fatal too. For one, if there's a regurgitation of the blood in the heart, and if the blood doesn't go forward, if the blood doesn't move smoothly forward, and there's some blood like regurgitating and moving backwards, we're gonna lose cardiac output, right? So when we lose cardiac output, that means we lose the oxygenated blood that the heart puts out. So we lose volume. So one, it could affect the patient's blood pressure, and two, what's in blood? The blood that the heart puts out is oxygenated blood, right? It's the blood with high oxygen content that our organ needs. Our brain, our tissue, our muscle need oxygen, and if we're not getting the same volume of the blood with high oxygen content, then we could feel tired, we could feel fatigue, we can feel with the brain, we can feel that there could be some loss of consciousness, So many symptoms, right? And how about on the right side? Let's say that the blood from the right ventricle regurgitates back into the right atrium. Then that blood could back up into a jugular. You see patient with jugular venous distension, or the blood can back up into your arm, on the blood can back up into a lower limb too, and that's edema. So patient now, if that's regurgitation of blood, patient can have edema or swelling of the arms and legs. And on the left side, if the blood from the left left ventricle doesn't go forward, if the blood from the left ventricle regurgitates back into the left atrium, then that's increasing the preload. Like there's going to be a lot of blood in the left atrium, and that blood can back up. And if the blood from the left atrium back up, where does that go? That blood has to go back into the lungs, right? And that could cause pulmonary edema, and that the patient's not going to be comfortable with pulmonary edema. That's going to be a lot of fluid in the lungs, so the patient's not going to be comfortable. So this is why it's important that the valve have to open, close in a timely manner to make sure that the blood that the heart's pumping move in one direction, and move forward into your systemic circulation. So when the heart pumps, that's when the cardiac muscle or the heart muscle contracts. That's called systole. And when the heart muscle relaxes and it receives blood, that's called diastole. So when it dilates, that's diastole, right? So when we talk about systole and diastole, we are actually most of the time we're looking at the ventricle. So ventricular systole, that's when your ventricle contracts and pumps blood away from the heart, right? And ventricular diastole, so that's when the ventricle relaxes, it fills the ventricle, receives blood, the blood moves back into the heart, right? And so the valves make sure that the blood moves in one direction. And what happens? So how does that all work? That the valves make sure that blood moves in one direction. So when the blood comes into the right atrium, right, your tricuspid valve will close, right? So your tricuspid valve will close and make sure when the blood comes into the right atrium, the blood doesn't leak into your ventricle. Once your deoxygenated blood is in your right atrium, your pulmonary valve closes. When your pulmonary valve closes, then your tricuspid valve open. And when your tricuspid valve open, that deoxygenated blood goes into your right ventricle. So it's in your right ventricle now, right? There's no leakage into your lungs because your pulmonary valve is closed. So once your blood goes into your deoxygenated blood goes from your right atrium to your right ventricle now. So now the valve up top here, your tricuspid valve will close. When your tricuspid valve closes, your pulmonary valve opens. So when your pulmonary valve opens, your ventricle, your right ventricle can pump that blood into your lungs. So that blood will goes into your pulmonary artery, past your pulmonary vein, past your pulmonary valve into your lungs. And when your right ventricle pumps that blood into your lung, there's no regurgitation of that blood back into your right ventricle because your tricuspid valve is closed, right? So now the blood goes into your lungs, get your oxygen and everything like that, and it has to go back into the heart. So back into the left atrium, and before the blood comes to the left atrium, the valve over here, the mitral valve, will close because it doesn't want the blood to leak into your ventricle, right? So the blood from the lung, oxygenated blood now, will come into your left atrium, right? And the left atrium, as I said, the valve over here, the mitral valve is closed, so the blood doesn't leak, right? So what happens next? Now your aortic valve will close, and now the mitral valve will open. When the mitral valve opens, the oxygenated blood from the left atrium will move from the left atrium to the left ventricle now, and there's no forward leakage into your aorta because your aortic valve is closed. And now when the oxygenated blood is in your left ventricle, what happens? The valve over here, the mitral valve, closes, right? And your aortic valve open, and your left ventricle can pump that oxygenated blood through your aorta into your systemic circulation, and there's no backflow, there's no leak, there's no regurgitation back into your left atrium because the mitral valve is closed, right? And this is how our heart maintain forward blood flow with our valve closing and opening at the appropriate time to make sure that there's no regurgitation of the blood backwards. So just a little bit more about these valves. So on the right side, your tricuspid valve, and on the left side, your mitral valve or your bicuspid valve. These set of valves, they're called atrial ventricular valve, and it's because they're in between the upper and the bottom chambers. They're located in between your atrium and your ventricles, right? So they're called atrial ventricular valve. And the main function of these atrial ventricular valve, your tricuspid and your mitral valve, the main function is to prevent the blood from regurgitating back into your atrium during when your ventricle pumps, during ventricular systole, when your ventricle pumps blood away from the heart. It doesn't want the blood to backflow into your atrium. So that's the main function of atrial ventricular valve, right? Your aortic valve and your pulmonary valve, these sets of valve together, they're called semilunar valve, right? Semilunar, they're called semilunar valve because they look like half moon, right? Semi, half, and lunar moon, right? So these valves, they look like half moon, so they're called semilunar valve, right? And the main purpose of the semilunar valve is to keep the blood away from the heart, right? So it doesn't want blood to it doesn't want the blood to regurgitate back into the heart. Remember, your aorta takes blood away from the heart into your systemic circulation, while your pulmonary artery takes blood away from the heart and into your lungs. So the purpose of these valves is during ventricular diastole, when your heart dilates, when your heart receives blood, it doesn't want the blood to leak back, to regurgitate back into the heart. So it doesn't want blood to regurgitate from your aorta back into your left ventricle. It doesn't want blood from your lungs to regurgitate back from your pulmonary artery into your right ventricle, right? So atrial ventricular valve keeps blood from regurgitating back into your atrium. Semilunar valves keeps blood from regurgitating back into your heart. So these valves, they don't open and close one by one, right? They don't open and close one by one. They open and close together in pairs, right? So your atrial ventricular valve, your mitral valve, and your tricuspid valve, those close together. And when those close, your semilunar valve open, right? When your semilunar valve open, your pulmonary valve and your aortic valve, when they open, your atrial ventricular valve closes. So they open and close in pairs. So when your atrial ventricular valve closes and your semilunar valve open, what happens? Okay, think about it. When your mitral valve close, your mitral valve close, your tricuspid valve close, your aortic valve, your pulmonary valve opens. So then what happens? This means your ventricles will pump. Your ventricles will pump on both sides, right? So your atrial ventricular valve closes, your semilunar valve opens. So on the right side, this means the blood, the deoxygenated blood is going to be pumped from your right ventricle into your lungs, and at the same time, your left ventricle is going to pump your oxygenated blood through your aorta and into your systemic circulation, right? So now let's think the opposite. Now your atrial ventricular valve are open and your semilunar valve are closed. So what does that mean? That means that if your semilunar valve are closed and your atrial ventricular valve are open, that means your ventricles are filling, right? So on the right side, the tricuspid valve is open. So that means that the blood from the right atrium, the deoxygenated blood, will come and fill your right ventricle. While on the left side, your mitral valve is open and your aortic valve is closed. So that means that your oxygenated blood from your left atrium will move into your left ventricle now. So these valves open and close in pairs, right? So your atrial ventricular valve, when they closes, your semilunar valve will open. When the semilunar valves are open, your atrial ventricular valve will close. So when these heart valves open closes, they contribute to heart sounds too, right? When we auscultate on the patient's heart, when we listen to the patient's heart with a stethoscope, and usually there's two sounds, right? Lub dub. Remember in your class, lub dub, lub dub. Lub is the first sound. Dub is the second heart sound, right? And during the lub, what happens that is when your atrial ventricular valve closes, and dub is when your semilunar valve closes. So what happens when the first heart sound, lub, when your atrial ventricular valve closes? What happens? That means your ventricle is pumping, right? The right side of the ventricle is pumping hard, pumping deoxygenated blood into your lungs. The left side of the ventricle is pumping your oxygenated blood into your systemic circulation to the rest of your body, right? And the second heart sound, dub, what happens? This means your semilunar valve is closing. So when the semilunar valve closes, that means your heart is ready to dilate, right? Your heart is ready to receive blood. The right side of the heart receives deoxygenated blood from your right atrium, while the left ventricle receives oxygenated blood from your left atrium, right? So lub dub, and so lub dub is when when your valve closed, lub, atrial ventricular valve closed, dub, your semilunar valve closed. And sometime we're gonna hear a third heart sound, so lub, dub, and a third heart sound, like a murmur or something. And this could be normal, or it could be pathological, something that we need to investigate further. So what kind of sound, what kind of murmur could it be? Like, what could cause murmur? Anything that causes turbulent flow. It could be, as I said, it could be pathological, or it could be normal. A few review video ago, I talked about pericarditis, how the cover of the heart can be inflamed, and that can cause like friction rub, and that could be a murmur. We can hear that in addition to the lub dub, and we can hear like a friction rub. So that's the third heart sound. Another example of third heart sound that we can hear is from something that we call the valve stenosis. Stenosis just simply mean like a thickening of the heart valve. It can happen to any valve. It can be calcification or anything like that, and that's called valve stenosis. So it'll cause like a turbulent blood flow when the blood flows through the valve, and that could be like a third heart sound. It could be a murmur. Another example is regurgitation, right? A valve regurgitation. So that's when the heart pumps, the blood moves backwards instead of going forward. Let's say there's a mitral. Let's say there's a mitral valve regurgitation. So when the heart pumps, instead of the blood going up through your aorta and through your systemic circulation, some blood's gonna move back into your left atrium, right? So that's regurgitation, and we can hear that. We can hear that too. Another murmur is when, let's say, there's a hole between the left side of the heart and the right side of the heart. There's a hole, and the blood can move through between left side of the heart and right side of the heart. And usually we see this during something we call ventricular septal defects. So we could hear the blood flow. We could hear the blood flow through the whole of the heart too. And when we hear a murmur, we're usually going to do an EKG on the patient, and we're going to do an echocardiogram to see the structure of the patient's heart, to see the defect, and to see if we need to correct the defect or not. Okay, I think that's enough review for today. I hope you find this video useful. The next review video, we're going to continue with the valve. So next one, we're going to look more closely at the structure of each valve. And then after that, I'm going to go with some clinical relevance, and then, talk about what they like to ask, especially on the board exam, especially the USMLE. Thank you again. I'm Dr. Chuck with CMAC.